Good morning, everybody. Welcome to our meeting, California Board of Occupational Therapy. Today is March 6th, and this point is 9:31. Let's take a roll.
Yes. Hector Cabrera,
Present.
Lena Doe,
Here.
Richard Bookwalter here, Christine Wittlisbach,
Here.
Beata Morcos.
Here. All right, President remarks. I would like to thank CAG Graduate Institute School of Health and Science for hosting us. What a lovely setup. We really appreciate it, and easy parking and everything. So we'll definitely be back. We're really liking it so far. And so thank you so much. We really appreciate that. My remark would be, I just would like to welcome our new interim executive officer, Austin Porter, who's been doing a great job. Do you want to say anything?
Thank you, Beata. I just want to say that it's an honor and a privilege for the board to put their trust in me to facilitate board staff operations, and I hope to be as useful as possible and help them in any way that I can.
Great, thank you. So that would conclude my remarks. Agenda number 3 would be board member remarks, information only, no board action to be taken. Any remarks?
Oh, thank you. I'm echoing thank you for inviting us here, and we're so easily bribed that we'll come back for food.
Hector, do you have any comments?
Well, I just want to thank Austin for being so proactive and supportive during this time of transition, also for myself. But yeah, thank you, and that's it.
Great, thank you so much. Agenda number 4, public comment for items not on the agenda. And this would be a good time for you to introduce yourself if you wish and make any comments and state your name. You don't have to. If you would like to, it's time to do all. Here's the mic.
Greetings to everyone. I'm Vikas Sharma. I'm the program director for the OTD program here at KGI. And I welcome all of you. Thank you so much. I think the licensing board is such an important, entity that, we all have licenses, and you guys are amazing. You are helping the consumers as well as, us, protecting us, and as well as the consumers. So thank you so much for all what you have been doing or done thus far, and I really appreciate it. And we have our students here, faculty here today, who will be learning side by side, and thank you for doing a presentation for our students today. So it is really appreciated. Thank you again.
Thank you so much. Anyone else?
Hi, good morning. My name is Kelly Aldright. I'm an assistant professor here at Keck Graduate Institute. So welcome. I hope you get to enjoy lunch in the village and don't run into rain as you're here. So.
Thanks, Kelly. Nice to meet you.
Hello, welcome. My name is Anna Sanchez, and I'm also an assistant professor here. So I hope you don't get too wet while you're here, and please make yourself some breakfast.
Thank you so much, Anna. Thank you. It's okay, we have time.
Hi, I'm Hannah Hunt. I'm assistant professor and capstone coordinator here. I'm really excited to have you guys here and see the process. And I've always hear about CBOT, right? From a student all the way through. So it's fun to see what actually happens. So thank you all for your help with the OT profession and everything. Welcome.
Thank you.
Hi, my name is Viviana Avila. I am a student here finishing up capstone project, but welcome and thank you.
Thank you. All right.
Don't be shy.
Hi, I'm Pearl Kim, also a student. Thank you and welcome.
Thank you.
Nice to meet you.
All right. Too shy? That's okay. Thank you for being here. Oh, sorry.
Hello, my name is Jennifer Jiang, and I work for OTT program as administrative support staff. And I see our program starting and is thriving now, and welcome everybody. If any questions, email me or call me. Thank you.
Thank you so much. Really appreciate it. All right, last call. All right, so we're moving on to agenda number 5, review and approval of the.
Madam Board President,
Yes.
this is David, the moderator.
Oh, sorry. Yeah, public comment. Yes, sorry. Yes. Please, let's open the public
Oh.
comment on the web.
All right, we are open for public comment for items not on the agenda online. If you'd like to make a comment via WebEx, please raise a hand by tapping that hand button at the bottom of the screen. For our dial-in users, dial *3 to raise your hand. And for our mobile device users, you have 3 different screens and only one of them has a hand button. So you may need to hit the ellipses button, that's the ... in order to find your hand. We're going to start with Ada Boone Horrell. Hold on just a moment. I'm going to send you a request to unmute your microphone.
Just wanted to introduce myself, Ada Boone Hurl, COTA Program Director, Sacramento City College Occupational Therapy Assistant Program. I'm very grateful to be able to join via WebEx and watch the work, the important work of the board today. Thank you all very much.
Thank you, Ada. We really appreciate you being part of it, as always.
Hi, Ada.
That appears to be our only request online.
All right. Thank you. Now the agenda number 5, review and approval of the November 14 and 15, 2024 board meeting minutes. I only had one comment. Just Christine and I, we kind of regrouped on that item number 9, where it says report from the EO selection committee. And it says committee chair. We don't have a chair. We were all equal, but it is what it is. We don't, if it's.
We can
it's
change
not
that.
Fix it.
I wasn't the chair.
We can get a change.
You can be the chair.
May I also make a suggestion, change for item number 8, report from the Ad hoc Committee on Disaster Preparedness. The last paragraph says that I stated that the consumer would not benefit from their practitioner being recognized as a first responder, and that's kind of an open question. And given the way our minutes are sometimes used to declare, declaration of a position by the board, I would say may or I would change would to may or may not.
That's a good idea.
The second to last paragraph in item 8 under public. The change, the consumer would not benefit from the practitioner being recognized as a first responder to the consumer may or may not be benefit. Since that's part of, we'll talk more about that today later, I think.
Any other comments? We have a motion.
I move to adopt the board meeting minutes from November 14, 15, 2024, with making the changes and any other that we've just discussed and any other non-substantive changes.
I'll second that.
All right, any further board discussion? We go to public comment. David, can we please go to public comment? But actually, do we have any comment here regarding the minutes? No? Okay. Can we please go to the WebEx?
We are open for public comment via WebEx. If you'd like to make a comment, please raise a hand by tapping that hand button at the bottom of the screen. Dial-in users, dial *3 to raise your hand, and we will call on people in the order we have requests. We're going to take just a few seconds now to see if we have a request for public comment on agenda item 5 and the motion. Seeing no request, you wish to continue with the motion?
Yes, please. Secretary Bookwalter, could you please do the roll?
Hector Cabrera,
Yes.
Lynn Doe,
Abstain.
Richard Bookwalter, yes. Christine Whitlisbach,
Yes.
Beata Morcos.
Yes. Motion carries. Minutes are adopted. Perfect. Thank you so much. Agenda number 6 is Administrative Committee update. Just for those of you who are not familiar with this setup, the reason why there are no minutes is because the Administrative Committee consists of the Executive Officer, Board President, and Vice President. Thereof, there is no legal requirement for notice or an agenda. And that's why we don't have meeting minutes, just so everybody is aware of that. We had 3 meetings that took place in the last 2 months. The first one was in January, was Mark, who was hired to be our executive officer, and we had to basically just regroup on that. Then in February, we had 2. One was Mark, and basically his resignation, and we had to regroup on his way out. And then the third meeting was Austin. We had to welcome him in and regroup on what's happening next. We mainly discussed solid strategic planning. And we talked about the budget, since our budget is extremely tight. And so Austin met with the budget office several times. So we got some ideas on how we can save money and stay healthy, if you will. And this is pretty much my update for that. Do you have any? No, that covers it. Right. Christine is the vice president, just for the clarification. Austin, do you have anything to add to it?
No, that's a perfect summary. There will be more on the budget later, a little bit more of an update, but as far as the administrative committee activities go, that's what it's.
Perfect. Thank you so much. Do we need to go anywhere? Public comment, please? Do you have any comments here? No? All right, David, can we please open it, public comment on WebEx?
We are open for public comment via WebEx. If you'd like to make a comment, please raise a hand by tapping that hand button at the bottom of the screen. Dial-in users, dial *3 to raise your hand, and we will call on people in the order we have requests. We're going to take just a few seconds now to see if we have a request for public comment. Seeing no request for public comment, you wish to continue with the agenda?
Yes, please. Thank you. There is no motion on the board since we don't really have anything to approve. Agenda number 7, report from the Ad Hoc Committee on Disaster Preparedness and Response, and that was Chair Bookwalter on that committee and is in charge.
Mrs. Marcus, in our packets, which are available in the back, and board members have, there's agenda item 7, there are 2 things in the packet on the agenda, or video. And I'd like to draw your attention to that. Like some minutes, April 29th, 2024, which was the 2024 meetings that we had. And we had another meeting on January 15th, 2025. In between those 2 meetings, couldn't really present the minutes because we had put up January 25. So the April 29th, we already reported that meeting last year. This is just the formal minutes on that. So we'll need to discuss voting on those as a topic of this, whether the board wants to accept them. And then the other minutes, I'd like to get more into substance of the draft minutes. Maybe, I don't know, however you want to start by documents, that we bought their content.
Sure. Yeah.
Okay, so I would move that the board accept the April 29, 2024 disaster preparedness and response committee minutes.
I'll second.
All right. Do we have any further board discussion on the meeting minutes? No? All right. We need to go to public comment. Do you have any comments regarding this meeting minutes? Anybody in person? I see no. David, could we please go to the WebEx?
We are open for public comment via WebEx on agenda item 7 and the motion. If you'd like to make a comment, please raise a hand by tapping that hand button at the bottom of the screen. Dial-in users dial *3 to raise your hand, and we will call on people in the order we have requests. We're going to take a few seconds now to see if we have a request for public comment. Seeing no request for public comment, do you wish to continue with the motion?
Yes, please.
All right, let's call the vote with Hector Cabrera,
Yes.
Linda Joe,
Hi.
Richard Buckwalter, yes, Christine Wittgenstein,
Yes.
and Marcos.
Yes. She carries.
Very good.
Thank you.
All right, thank you. So moving on. Now, the reason there was a gap between April 29 and 2024 and our that partly is because we had discussed last year a survey of speaking practitioners to find out what their experience of disaster preparedness and response as it is in the workplace, and that survey has to be vetted, and the survey has to be rolled out. And these responses, there was a time between the April meeting meeting last year, the JT meeting of this year when the results came in. So the draft minutes in front of you for January 15th are a meeting that we had on January 15th. Hector Cabrera is on the committee. I'm on the city, and Mary Everett is on the committee as a non-board member and a former. And then wanted to go over the result of the survey, and those are in your packet, actually. There were 8 questions that are going to respond. You can have that in a minute. So we were, we should just take. Well, first of all, on the minutes, we talked about item number 5 in the draft minutes. We talked about the board websites. The other thing that we did, that we met last year, that was enacted by the board staff, is to make 2 web pages, one for the consumer, one for the licensee, that have resources on disaster preparedness, links to websites, places you can go. There's quite a robust state infrastructure information to go back to these community sources and whatnot. So, and also the local generation and other resources. So we put that on websites so they're more accessible to practitioners and consumers. So that is what we discussed, and we took a look at that and decided that this was good. Basically, Hector, you're on the committee, so I would love it if you would just type in, follow on, I think read it, just stuff that we're talking about. Okay, and then we went to. We also had the participation of a very. We had an introduction of the first responders, which is I mentioned and whether that would be OT were not good or not be first responders, or not classified as first responders. And how those are defined. Had a participant in our meeting who turned out to be she's Emily Baylov. She's a professor at Rutgers University in occupational therapy and assistance. Had been in the Air Force and the emergency manager report that this is kind of an area of interest of hers. And she actually has done some work in the area at the beginning to do for me. We had preparedness. And this is something that she's on her research on. So it was very interesting to have her as a participant because she was, while we're meeting, she was looking up, different definitions of different government agencies about what's different kinds of types of responders and maybe a larger research project to build on sort of small amount of work that we have done. Greater. And we talked about reaching out to advocacy. We talked about reaching out to advocacy groups on the first responder question, because of that question about how much is it as a consumer issue, how much of it is a promotion of OT as a profession issue. And then we also, as it happens, we did get a letter from Samia Rafidi, the president of OTAC, spoke with us at the meeting, and then also sent us a letter after the meeting saying that OTAC would be interested in pursuing maybe promoting OT as a first responder efforts. I wanted to bring that. That's a question for the board as to how much we want to get involved in that as the board, as opposed to leaving that to the professional association. And then we also had directed the staff to find out what the definitions of first responder are, which gets to be more complicated than we thought it was. So that's a question for the board. The other one is to discuss our survey. Do you want to talk about the first responder thing now, and then we can move on to the survey thing? How much does this board want to pursue the idea of OTs being first responders? We've talked about it because it's been discussed that first responders have a certain status, they have certain benefits, financial benefits, and and a certain status in the community and certain privileges, which who doesn't want a privilege or a lower loan rate or a preferential treatment? But are OTs really the first responders? I mean, when your house is collapsed, is the first thing you think, my grandmother's lying there, do I want to get an OT? Or do you want to get a fireman, EMT, a policeman, all the, I personally, I'm not sure that we are first responders. You have primary care, you have secondary care. I'm content with not being a primary care provider, but some OTs may not be, right? And so, yeah.
So I have a question about that. Yeah, I don't think of OTs as first responders, but I was curious, Emily Bela, what was her thoughts on that? Did you talk to her about that interview?
She actually was looking up online different definitions, and I didn't, as defined by the Department of Homeland Security. She looked at the distinction between first responders and emergency response providers. So she was more getting into the weeds of how does that look? How does first responder look across different agencies, and maybe how does OT fit in that? I don't think that she expressed some doubt. She was not unequivocally saying no, that OTs are first responders either.
And Mary Everett, and the reason I asked about these two people in particular is because they just kind of have a wider experience with this discussion. So what about Mary Everett?
Well, Mary Everett brought up examples of providing on-the-ground mental health support for when people are in an emergency situation. Being on the ground and doing that because of her experience with Terry, whose name I can't remember at the moment, Terry Crow, and she had been wanting us to get involved with Terry Crow, but Terry Crow's retired. She found out Terry Crow is not really available. Because Terry Crow had been involved, I think, in Hurricane Katrina and had been in efforts to provide mental health emergency mental health services in a way, or community support.
First responders.
Well, that's a question that,
Okay.
I mean, a lot of people there are other professions that can provide emergency mental health support, social work, MSWs and yeah. So the question would be, I mean, it wasn't convincing to me that, but that's we're the first go-to service. I do feel, anyway.
No,
Not,
what you,
well, I feel like as a secondary response, we do have a role to play in shelters, in accessibility of emergency facilities, in working with, especially with certain populations. The whole notion of autistic kids and neurodivergent kids and handling, and adults, and handling that whole overwhelming situation, and helping to structure environments where those people can be safe in an emergency situation. Providing care for people in nursing homes who need to be transitioned out of buildings and they require adaptive equipment and assistance and levels of, triaging levels of assistance and who could provide it, providing caregiver training for those to provide that assistance when their caregiver network breaks down. All those things I think we have a very, very important role in and could contribute a lot. Yeah, so I view that as more of a secondary response personally.
it's a tough one because, and you're probably the same boat as me, like, I tend to agree with you, but I want to make sure that my biases and my limited view of what like I've experienced isn't limiting the overall thought of where we could be.
Exactly. I don't want to bring everybody down. Like that statement in the, and the other thing about this meeting in January 15th is it occurs right on the heels of the LA fires. As we all know, California is dominated by Los Angeles. The Los Angeles County has bigger population than most states in the United States. And this was a hugely traumatic experience for here. And it could bring more initiative to develop emergency response and preparedness as on the heels of that very, very influential disaster.
Have we gotten any members of the public or any input from anyone outside the committee, saying like, yes, we strongly believe that there's a role as first responders? Has there?
We have not really, not that but yeah. Well, maybe that's a good segue into the discussion of the survey. Oh, go ahead, Lynn.
So I looked it up while you guys were talking.
Oh, yeah.
And public health officials are included as the first 6 types of first responders. So technically, as a public health provider, you guys the OT profession would qualify under as a first responder. Not a secondary, and that's going with California law and the US code. So if we want to pursue it, it's in there. I mean, the law says public health officials are one of the first 6 professions included as first responders.
Do they technically mean OTs when they're thinking of public health?
I would say I have a view on that. From my husband worked in contracting for the city and county of San Francisco, which has earthquakes, and they have earthquake preparedness, and he actually did a disaster training and and they have to get supplies. During the pandemic, they had to get masks. They have to have, to be blunt, body bags, ready for people who, when in the event of a disaster, if a large people are going to die, they have to be able to put them somewhere. So they have a lot of supply and other issues that have to be taken care of. And I think of that.
When I worked for the city of San Francisco, it didn't matter, what my job was, that if there was a disaster, I was going to be called in. And I didn't have all that body bags. I was just a political aid to a.
Okay, yeah.
And they didn't even prepare us. We didn't even get training. We just said that, they said that if there was some disaster, we're calling you and you have to show up. This is your legal requirement. So, I mean, that's part of the first responders emergencies too, but.
Well, if you look at it that way, I mean,
Yeah. No, but go ahead.
If you look at it that way, I mean, if you work for a hospital, let's say, not all OTs work for hospitals, but let's just say if you're looking at it that way, we are required to
report. Yeah, right.
Respond
Right.
in an emergency.
Well, yeah, when I was supervising outpatient PTOT and speech, and I had to go. We had a big gym with lots of mats where all the PTs would do their mat treatments, and a couple of OTs as well. But then those were going to be beds. Those are going to be triage beds, in the event of a disaster, that was going to be a overflow from the emergency room. That was our whole thing.
And we do become first responders. We're not doing OT, necessarily. They just assign us, like maybe we're doing whatever. I mean, maybe we do OT, maybe we don't, it just really depends, like. But I could see.
But the CUS have training, and that it comes in handy and helpful if, there is something and there is like a civilian like me who was not trained in a healing profession per se, because mine is not this to your head and that doesn't help anybody. But you were trained to help with movements and helping, someone with a hand injury, you would know what to do. And so in a way, I'm here advocating for this profession because I think you as a first responder would be more beneficial than me as a non-trained, in the healing profession.
Well, okay, so I kind of agree with this because I could see like as OTs, we're trained in transfers. So like we could help, like, okay, you guys are OTs, you're gonna help evacuate. You know how to handle people, you know how to move people safe, right? So you're gonna help the paramedics move these 2,000 people, Okay, if you're the hand therapist, you're gonna be assigned to the orthopedic surgeons, you're gonna help with splinting stuff, fractures and things like that. Like, I can see like, not in our tradition, like this is kind of what we were thinking in the beginning, but I could see how like by virtue of the fact that we are OTs, like, we would be put in that role that we do this with kindness. Yeah, yeah. I'm kind of getting where she's going with this. Where we are put in that. We don't really have a choice. Like, we have to respond. We can't just stay at home and say, I didn't get the call.
You can't pretend you didn't see the earthquake, right?
But are you the first call or are you the second call? But anyway, yeah. Do you want to?
It's always a good time for public comment.
All right, let's open it to public comment. Should I go up there? Do I stick? Microphone used to go.
Here.
It's only because if you're not on the mic, people watch.
Sorry, too much rattling.
This discussion is really interesting. And I, at first was with you like, oh, are we really first responders that when they have that disaster happen? But then I was thinking back to my experience. I've worked in a hospital for many years at Rancho Los Amigos. And when COVID happened, we were disaster service workers. And when we start working for the LA County, we sign up to be a disaster service worker. And it's just part of your role, like if there is a disaster, you're called in. And so during COVID, we were sent out to act potentially as nurses. And there was a portion of us that worked as nurses during that time, or CNAs. We weren't giving medicines or IVs, but we were more the role of the CNA because we knew how to do transfers. We knew how to help with certain things like maybe swallowing or IC or different things like that. So just to kind of add to the discussion, we have been called as disaster service workers. And it wasn't just the OTs there, though. It's everybody that works in that hospital and has those certain skills. And some of my colleagues were, sent out to the nursing units for 2 or 3 months during that time.
That happened at our hospital.
Yeah.
We're just a private nonprofit, like we're not even part of the county system or anything like that. So yeah.
So it was widespread. Yeah. So just to add, I still understand, where do we lie? I don't know, but yeah.
Did it make you feel that you were doing the work without receiving the benefits that others were receiving, like nurses and whatnot?
No, because at that time we were included in that role. Like, when there was offers for deals on like shoes, like there was like the Nike shoe deal, or there was all these things, OTs were included in that. But I don't know, I guess I don't know all of the benefits you get from being a first responder, but during COVID, I felt like I was treated like a first responder. I don't now.
We got a lot of the informal deals, like, hey,
Yeah.
come at this time and get your toilet paper.
Yes, exactly.
Deals. And that was a big deal. I could not get toilet paper for a
Well-
while because I was working.
Yeah, but then,
Tables.
yeah.
Well, I'm sorry. Well, when you look at Google, are nurses first responders? It says no, nurses are not, first responders, according to technically. So, I mean, it becomes like,
Yeah.
Well, the reason I brought it up because about a year or so ago when this discussion was happening and we had several attendees at that point and they just felt really hurt that while nurses get paid at least 3 times the amount, while kind of the work was done similarly across the board,
That wasn't about being first responders, though. That was about scarcity of resources and they couldn't get a nurse. That was a different
Oh, well,
issue.
but it was kind of part of like getting, kind of doing the work for the, well, I guess.
Yeah, it wasn't about being first responders, but yes.
But I guess if nurses aren't first responders,
Yeah.
then we shouldn't be first responder. That's kind of like my gut reaction
Right.
to that, right?
Nurses aren't first
Well, it
responders.
depends on who you look, because Lululemon lets nurses get discounts.
so, okay, so it's a tough, so we are having another, I don't mean to, we are having another meeting, we planned for April, and on the agenda is, with board approval was the question of, does the board, is it the will of the board that this committee and further investigate the first responder thing, and maybe in collaboration with the professional association, and sort of have further discussions about that and bring more back to the board, or maybe we want to have the discussion right here, but it's.
Finish the public comment until.
Sorry.
Sorry, so this way. Sorry, anybody else has comments? So we'll do this and then we'll go to the WebEx and then we'll continue our
That
discussion.
sounds good.
Thank you so much.
This is fine. Sorry we didn't let you sit down. I apologize.
So I think Hannah said beautifully, like how in the hospital it is different. I think it depends upon the type of the setting you are working at. I worked all my life before I moved into academia. I was working in a SNF, skilled nursing facility, as a director of rehab and as an OT. And whenever there is any crisis or any disaster, there was one time there was an earthquake shaking. So it was all the time the nurses were running, and of course we were running also as to save, to make sure that the patients are safe, or if there is any triage or any kind of a disaster. So I think it is all about education, and it is going to come with time. I do think that something need to be done more at an association level, or to promote that, how OTs can really help in as a first responder. And I do agree, during the COVID time, I know some of my friends, they were like all in shields and, all those kind of things. And they were, responding to the patients right away, whether it was infection control or anything. So I think this is something emerging and which will change with time, and we will get our feet soaked there sometime. So that's what I think. Thank you.
Thank you so much. Do we have any other public comments in the room? No? David, can we please go to public comment on WebEx?
We are open for public comment via WebEx. If you'd like to make a comment, please raise a hand by tapping that hand button at the bottom of the screen. Dial-in users, dial *3 to raise your hand, and we will call on people in the order we have requests. And our first request comes from Ada Boone-Horrell. Hold on just a moment. We're sending you a request to unmute your microphone.
Thank you. I appreciate this conversation. I'm a fireman's daughter, and many years ago, I did Red Cross disaster training. This was before I even knew about occupational therapy. And so the Red Cross does disaster training for public members to become volunteer participants in some kind of disaster support. I don't want to use the term first responder, but they also have a mental health responder training program that anybody in the public can do. And then we have programs, like mental health first aid and all of that. So I'm looking at it. I'm not getting stuck on the word first responder, because I think that there's language that can be crafted that's more representative of the potential for occupational therapy practitioners to participate in disaster relief. And my opinion is that it would be beneficial if the board explored it because of the consumer protection factor. And defining the role of OT in disaster support also helps validate our presence, I think, because it would give a well-crafted, defined, publicly stated scope, for lack of a better word at the moment, of OT's potential to support in disaster situations. And if we do, we've all, either been through or are knowledgeable about the types of disasters that we can have here in California, and easily analyze different ways that we could make a contribution in that process. I'm looking forward to this April meeting. I didn't realize that there was coming. So I also looked at the California Disaster Healthcare website there's a link to on the board's website. And they have a extremely detailed deployment manual and other steps and procedures of who goes when. So that's another factor that pulls me in my mindset away from the term first responder, but disaster support. Thank you for letting me contribute. Thank you.
Thank you, Ada.
Thank you.
Do we have anybody else?
That was our only request for public comment via WebEx.
Thank you, David. Richard?
Sure. Okay. So, I mean, there is, I mean, the World Federation of OT has an 81-page pamphlet on disaster preparedness and occupational therapy, and the AOTA has statements about it. So, there, we would have, the committee's looked at that. The board has had copies has been presented with this information. So the question I would just have as a committee chair would be, what do we have to add as a committee to this discussion? Does the board define occupational therapy practice in terms of this, or is it defined in these documents that exist? Or, and what do we do about it? And do we do something in collaboration with the professional association? We have had an outreach from from OTAC about, on the heels of especially on the heels of the LA fire disaster, to develop this. So if the board would like, you guys think we should talk about that at our next board meeting, and the role of OT? Okay, so we put that on the agenda. That was our intention, but I kind of wanted to run it by the board to find out how much you wanted us to get into that as a board committee. And then the other aspect, it's actually a pretty good segue, if it's okay to move on further at the moment, with item number 6, the survey results, the survey results that came in. One of the things that, so we had a discussion about this, how we had basically 182 respondents. There were 8 questions. There were a number of ones that people skipped, and there's information here that you've reviewed about people's opinions. The opinion of the committee on looking at this, and Mary Everett especially said, this doesn't really give us all the information. It's kind of a small sample, doesn't really give us direction in terms of what action to propose to the board. We just had a big disaster in LA. Why don't we do another survey that's shorter? That was a discussion that we had at the committee. That's a question because would a shorter, but it might get more people because of the energy around disaster preparedness following the LA fires. Let's do another survey. I balked at that a little bit because we just did a survey and this is what we got. And how many surveys do we have a series of surveys to figure out what we're doing? Are these results, if we have fewer questions, are we really going to expand on these survey results and get more direction from a survey? But that's, Hector, you feel free to talk about you were at the meeting. What are your thoughts on another survey?
Well, given the fact that after now that more things have surfaced and more people are more animated to talk about what needs to be done, what other perhaps services need to be implemented. I think that this would be a good time to implement another survey. I've seen people more energized and much more vocal now since this. We probably could get some more information.
I was going to comment that if we did a survey, I think survey should be based on the fact that the LA fires happened and survey if people actually were pulled into the as disaster recovery participants. And if so, what were they tasked with doing? And did they feel prepared in the role? And if not, what could have been given to them? But I think that kind of survey would be more beneficial to see if we continue this, task of we advocate for first responder status. Do we, make sure that the OT profession is included in disaster recovery and relief stuff, and how we get that moving, because I think it's important to see how many people actually got pulled into this and what they were tasked with doing.
Yeah, because currently there's a lot of town hall meetings still being conducted, and I think this would be a good time to tap in to the opinions and do another survey.
I don't want to be a Debbie Downer, but how much did the survey cost? Or are we just doing an email?
The survey was facilitated by Solid at DCA, so I don't believe that there was any direct cost to the board. We didn't have to have like our own subscription like we were wondering about before for like a Survey Monkey account or anything like that. Solid has a platform that they offer to let us use to administer the survey.
Okay, I'm thinking about our budget. Okay.
That's another reason we have to discuss it here, yeah. Because I didn't know that
Yeah, okay.
either.
I mean, what was our response rate? Do you even know?
Well, yeah, that we received, I mean, there were 18,000, roughly 18,000 OT practitioners, or 23,000 maybe. And then we had 182 responses. And when you look at the response, this is a convenience sample. It's not a scientific sample, obviously. It's whoever. It was at the OTAC conference. There was a barcode that we used a barcode, and there was also other social media and other things. And then when you look at the questions, my take on this questions, like when you look at question 3, 136 answered and 46 did not respond. 5, 6, 5, and 7. The ones that involved what happens in the workplace, there were roughly 45 to 49 people that didn't respond, which makes me think that those might be students because they may not have a workplace.
Sure.
And that would make sense that the workplace, because originally the survey was 3 questions. This board got together, we decided we wanted to try to gather a little bit more information. We made it, 8 questions. And then, and some of the questions are specific to licensee type and workplace related things that I don't know. I don't think we have evidence about whether they were students or not. I don't know that we have that.
Well, if you look here, what population do you treat? 47 people skip that question.
Right. So that's another reason I thought that those might be students, because they didn't have. So if we're looking at, we got 135 practitioners out of 20,000, let's say. It's a pretty small group that responded, or that we were able to reach. We don't even know if we reached,
Well, I mean, I think if we could do it quickly, and I agree, there's probably is some momentum, thank you, after the LA fires. I mean, it's not going to cost us anything if we could just put together a few questions.
So shall we discuss that at our April meeting as well? Come up with some more questions? Okay.
Yeah.
All right. That's direction from the board is very helpful in this regard. Thank you. The meeting's April 16th at 9 a.m. It's going to be online. And we'll make sure Emily Baylog knows because she can join us. Hopefully she can join us again. I think she was present when we talked about that.
There's no way to move that meeting up. It's a long way away.
I'm out of the country, I'm
Oh,
afraid.
right.
So
It is what it is.
I'm sorry.
Can you cancel your vacation?
I could. Actually, no,
Not refundable.
it would be punishable by death, I think.
Could we also add, just what would be the procedure of it all? Like, let's say, should we proceed with maybe perhaps not first responders, but as Ada mentioned, disaster professionals, disaster preparedness professionals?
The word
Well,
she used, yeah.
Exactly, I think that's exactly, but maybe I'm not quoting. Just an idea to what would be the procedure to become that, to have that title for the OTs and OTAs.
Does anyone remember the exact word she used? That might be it. I just don't remember.
It should be in a transcript.
It will be, but I just wondered if anyone remembered. No one does.
Ada?
Public comment?
Can we open it back up, Ada? If you could tell us?
This is the moderator. We're going to get Ada back online.
I think the question is just what term did I use? I just talked about a disaster responder.
That's the responder, that's it. That's
Yeah.
what it is.
Yeah.
Since we have you here, do you have any spare time to, for our board to be like, maybe perhaps part of this committee?
That's part of what I'm looking at in my computer to now that I know the date. So
Would you
I'm
look?
looking for my calendar and because I'm very interested in this.
Committee members are appointed by the board president.
That's why I'm bringing it up.
And April 16th, I am available and thank you for asking.
All righty, you're officially on the committee.
April 6th.
Oh.
I missed that. No, April 16th. Is that correct?
April 16th at 9 a.m.
Okay, thank you. Please send me an invite. I'm happy to do it.
Wonderful. Thank you.
Thank you.
Officially. Thank you.
You're welcome.
Wonderful. That concludes my report to the board, and thank you for the advice of the board on how to proceed.
True.
You need to accept the January 15th meeting?
No, because we haven't voted on, the committee will vote on them on April 16th and bring them back for the board to adopt. And also the number of meetings we have, meetings do cost money even though they're online. So the board, if you have there is a concern about how many times we meet, please let me know. We do have this one scheduled, but if there's a limit to how many meetings we should be having or anything like that,
We'll let you know.
let us know.
Thank you, Richard.
Thank you.
Great report.
More public comment?
Yeah. Do we have any for the board comments? Do we have any public comment? Anything to add? Right. David, can we please open to public comment on WebEx?
We are open for public comment via WebEx. If you'd like to make a comment, please raise a hand by tapping that hand button at the bottom of the screen. Dial-in users, dial *3 to raise your hand, and we will call on people in the order we have requests. We're going to take a few seconds now to see if we have a request. And it looks like our first request is coming from Candace. Hold on just a moment. We're sending you a request to unmute your microphone.
Hi, I'm Candace. I'm treasurer of the Occupational Therapy Association of California. I just wanted to let you know that I'm here to support and to be a part of the public, also to hear the great work that the disaster preparedness team has done, as well as the additional agendas items that you have for today. I do want to, I just also just wanted to chime in to definitely express my support and appreciation for the work the disaster preparedness team has done. It can be really hard to get people to respond to those surveys, and just to provide some encouragement to keep up the good work. I mean, we've seen it in real time, what we needed, what can happen when we don't have it. I think last year, a lot of us probably thought, oh, you know what, this might not be as necessary. Oh, when are we going to have an earthquake? And then bam, when are we going to have a fire? And then bam, things start to happen. And so thank you for the work you're doing. Hopefully there'll be more responses this year from individuals as they see like the need of it. And so thank you all. Also, thank you to the entire board for your work.
Thank you, Candace.
And that appears to be our only request online.
Thank you, David. Do we need to take a little break?
Yes, please.
Okay. Since I heard the bathroom was a little bit far, so it's 10, yes, should we recommend 10:40?
Yes.
10:45. 10:40. All righty. So, Secretary Potter, can you please do the reestablish form?
Hector Cabrera, are you here?
Yes, I am.
Lynn Doe?
Here.
Richard Bookwalter here. Christine Wheatlesbach?
Here.
Beata Morcos.
Here. Thank you so much. We have it for. And we're gonna proceed to agenda number 8, update on the Board of Prospectus Reviewer application changes. Austin, could you please present us with the changes that were made to the application?
For the Morcos. So this is really just to bring before the board one more time, just to show them what was done on action taken at the last meeting. That meeting, there was discussion about whether occupational therapy assistants could apply to be practice reviewers for the board. And it was decided that it would be beneficial to include them so that we could increase the number of practice reviewers that we have available to us. So this is just to provide the board with another look at the updated application. So if you look at the application, you can see in the second line that it has added the phrase "and occupational therapy assistants" in the first paragraph there. And then down below, underneath the line of bold text, it was changed on the application. It previously said at least 15 years of experience, which was a mistake. It's been updated on the application to match what it says now on the board's website for practice reviewers, just 10 years of experience. And on the website as well, we added the part about occupational therapy assistants. So this is just for the board to have one last look at it and see if there's any changes still needed, but this is what's been changed. That's just those 2 small changes.
All right. So what does the board think?
It's good, what we discussed.
I move that we, do we have to have a motion to accept, or is this already something we did?
This is something that was already voted on. This is just a last look. If you guys have noticed any issues or anything that still looks wrong, you can bring that up now, but this is just a last look at it for you guys.
Great, thanks, I have no.
Any further board discussion? No? David, Hector, do you have any comments on this?
No, I'm not.
All right, David, can we please open to public on WebEx? You have WebEx, please.
Absolutely. We are open for public comment via WebEx. If you'd like to make a comment, please raise a hand by tapping that hand button at the bottom of the screen. Dial-in users, dial *3 to raise your hand, and we will call on people in the order we have requests. And our first request is coming from Ada Boone Horrell. Hold on just a moment, please. We're sending you a request to unmute your microphone.
If I may, I have a clarifying, just a question about the type, when it says experience in the area. So would something like experience in the scope of practice of the OTA, say there was a question about that, is that what the term experience means? I'm confused on that term, and I appreciate the clarification.
So the first part is talking about just 10 years of experience in the profession in general. And then it goes on to say with 7 years of recent experience in the area of expertise for which they will be reviewing cases. So below that, there's a section, these different check boxes. So those would be the areas that we're looking for that 7 years of recent experience, private practice, pediatric, school-based practice, etc.
Thank you. I appreciate that. Thank you.
Thank you, Ada. Do you have any other public comments?
No other requests for public comment via WebEx.
Yeah. Thank you. So, we're moving on. All right. Agenda number 9, discussion and possible action on the sunset review process and possible sunset committee member appointment.
So for this agenda item, we have included the minutes from the last Sunset Review Committee that met in 2021. This is the last time that the board went through the Sunset Review process. These are included mostly just to provide information and background to any board members who may not have been here for the last Sunset Review, and to just provide an idea of what to expect for a Sunset Review Committee, what they might be going over.
So, I'm sorry.
Do you want to tell the public what the sunset is, who might not be familiar?
Oh, sure.
I was just wondering. It's not my.
So as a little bit of background, the sunset review process, I believe it's every 4 years, sometimes give or take, if an extension is granted at our request. The board and the executive officer go before the California legislature to provide an update on the board's activities, their processes, staffing, meetings that have occurred, and to address any issues that the legislature might have discovered from the last sunset review or from the report that we return in this time. And it's just an opportunity for them to essentially do a review of the board and make sure that everything is going smoothly, and to extend essentially the board's existence and necessity to regulate the profession for the next 4 years or however long it's going to be until the next sunset report.
So there's a need for us to exist. We're doing a good job, things like that.
Because our legal mandate ends on what's the date?
I don't have the exact date in front of me, but I know that
That's the next.
I think it's sometime in 2026. So we have to get the review in before the end of this year, and then there will be a hearing early 2026 before that, where the legislature will make their decision.
So it looks like, and tell me if I'm wrong, it looks like the people on the committee was the board chair, maybe the vice chair, and then a couple other people. Is that
I think
accurate?
president is always on it.
Oh,
Vice president was not always on it.
Okay.
And then the rest of the members, and then we had public members.
Oh, okay.
That was,
So public
oh, well,
members-
sorry, no, they were let up. Sorry, no. I was on 2 committees and it was a lot of meetings and there was a lot going on and a lot of review. We received the questionnaires kind of prior to that and we sent out surveys to the stakeholders. A lot of times we didn't have, we were lucky receiving a lot of responses. So unfortunately, it's very tricky because at that point, the last one, we had about 18,000 members and I think we had 12 responses. And so if those 12 responses are not the most positive, overall, the percentage is not fair, right? Because if it would be thousands of people and the percentage is off or whatever, that's a different story. So, and we have to include that into our sunset report. So I've never actually been in front of the sunset committee. I was only on the committee getting prepared for the sunset. But Richard, you've spoken in front of the sunset, the legislators. So if you have anything you'd like to share with us, that. very intense?
Yeah, I mean, it's a day where you go in and this committee is there. And as the day goes on, fewer and fewer committee members. It's a mixed committee of the legislature and the Senate, the business and professions subcommittees or committees within those, the legislature and the assembly, I should say. I'm sorry, the Senate assembly. And then and they're there and they ask questions and they want to know, are you managing your money well? Are you doing the job that the legislature has asked you to do? And there are all these questions which are reflected in the document here. And then usually they have like 25 questions. They have a certain number of questions that are pretty much the same every 4 years. Then they add 5 gotcha questions at the last minute, and you have to answer those. But then it's also multiple boards on one day, and I think both times. I only attended one of these, but I've heard that some of the committee members leave. We're not usually the first one, and usually they get shorter and shorter and shorter reports as the day goes on. So I probably said too much. Denise and I both had statements. Denise was president, I was vice president, and I had a statement. I probably should not have I should probably just have said I have nothing to add or something, because they were ready to just move on. And OTAC came and they testified. They can also support the board's, the public is there, so they can say we support the continuation of the board for 4 more years. And then you get this responses from the joint committee where they say, these are the issues that we want you to look at over the next 4 years, and you better address those at your next sunset report, which we've done, I think, as we can go through.
And I assume they ask you about those. But I assume they ask you at your next sunset hearing, did you address these?
Yeah. You can expect, like, one of the things we had here that dates way back is, are you going to add an ethics or jurisprudence exam? That's one of the questions that's in this old report. And we only did that. We finally got to that last year. That actually carried over from a previous sunset. We didn't address it. They could have reduced. They could have said, you got to come back 2 years and do this all over again, because we don't, if they're unhappy. And they have also looked at things like the content of continuing education. How strict are you about whether continuing education applies to consumer protection for this population? Or is it just, whatever they've sometimes criticized what's acceptable continuing education classes accepted by some boards. That's a pet concern of them. Like,
They don't want fluff.
They don't want fluff. Yeah, they don't want something that's unnecessarily.
Sorry, unnecessarily burdensome is something they also look at to either for unnecessary barriers to licensure as well as unnecessary barriers to maintaining a license.
Protectionism, kind of like a protectionism concern that they have.
Okay. We can do that.
And if I could just correct what I said earlier in response to Mr. Cookwater's question about when the date was, I said 2026. It's apparently January 1st, 2027. But we have to get this done by the end of the year. There's a lot of process leading into it. So,
yeah, essentially the legislature will make a decision usually no later than fall of 2026, because otherwise all laws disappear January 1.
So the hearing will be like in the spring of 2026, probably. And then we have to have our report ready by the fall of 2025 or the end of 2020.
End of the year.
Yeah, end of 2025, so that it feeds into the hearings in the spring.
Will you still be on the board?
Yeah, but this year.
Yeah. I will not be on the board.
It's an mini heart attack.
I'm glad you know so much faith in me. I mean, it's a little scary for me, just I read the report and it's big, even working on it, in the end of the day, it's just such a, so much like valuable information and so many details, and we have to deliver that. So we really need to get a committee going here as soon as possible. Some boards, they start 1.5 years in advance, and we basically have until the end of this year to make it happen. So
let's start.
The good news is that a lot of the questions are going to be asking for the same information as they did for the 2021 report. So while some surprises might be in there, board staff can get a good early start on preparing a lot of the information that's expected to be the same.
Well, there's slim pickings for the committee members, so that should be easy.
Yeah.
We were a 7 member board. However, 2 of the position expired in the end of last year, and the governor hasn't reappointed anybody yet. So we have an open position for an OT and 1 for OTA.
So we're anxiously awaiting this. But right now, let's get on to this. We can,
Right.
yeah.
Well,
So are you appointing?
or would be interested.
I'll join.
I feel compelled to join.
Okay.
And you'll be.
And I'll be on the committee.
I'm sure.
Hector,
Yes.
Any interest, or you got other things going on? It's okay if you do. Okay.
Are you asking me a question here?
yes, we're talking about who's gonna be on the sunset committee.
Oh, I'd be interested.
Okay. Do we need to confirm anything else?
You, as far as we get to point them.
No, I know. It's like, that's the 4 or the 2 committee or?
No,
Okay, we
four,
had 4
it's
before.
four.
Okay, okay.
Or on a committee?
Well, because of the sunset committee. that's what-
There's 4 last time. I'm just going by what you showed us.
Well, 4 creates a quorum.
No, I don't know how we had that.
I don't either.
It was also during it was when we had the looser telecommunication meeting rules.
Yeah, because a quorum would still create a board meeting. I think there was an error that was discovered, and I don't know that specifically this one, where we accidentally did have a quorum present on some type of committee. So then we had to reverse that and remove 1 member. So I would recommend we not. In order for it to be a committee, we have 3 or less.
All right, well,
Okay, so let's explain to them why we. So during the
Right.
pandemic, there were some looser rules about how many people could be on the committee and how you had to meet and things like that. So we're thinking we have to reduce the number of people on a committee because now there's stricter rules about how we have to meet and yeah, so how many people do you recommend?
3 or less.
Okay. Hector, do you really, really want to be on this committee?
Yes.
I will back out.
No, you have to be. You're
Well-
the vice president.
I don't have to be.
Well,
And let me tell you why.
Next year. And,
Well,
and
he can still go to the hearing, but I think it's imperative that Richard be on the committee because it's all about the work that was done when he was president.
okay, I'm sorry, Hector. I think at this point we have to have Christine on it because this is your grace year, and we're not, if you're not gonna get reappointed, then you're not gonna be able to help further. And I can jeopardize that. I'm sorry. We will find another committee you can serve on, okay?
Okay.
Thank you. So it's gonna be Richard, Christine, and I. We have to have somebody who's gonna be on this board next year. For sure. So the way it works, this is Richard's grace year, which means his place could be reappointed. His position can be reappointed at any given time, and the same with Hector. It's also his grace year. And so Hector was appointed by the Speaker of the Assembly, and reappointment can happen today or 2 weeks later, or it can be the end of the year. And Richard's term expired because you already appointed 2 times. So for sure, Richard will not be appointed, unfortunately, to this board. If that, just to clarify all of our situation.
But we need Richard on the committee.
Yeah, we do.
Because he was
on it.
immediate
Right.
past presidents.
Right. The contribution there is gonna be huge.
Yeah.
There's a lot to deal with.
Okay.
All right, do we need to make an official motion or just this is it?
For committee members? No, you set them. And to also just provide a note, nothing requires that you have to set people today. So if you ever wanted to consider who to set, yeah. So I mean, we already have it for this one, but just in the future, you can say, you can take it under advisement and we can announce it at the next meeting.
All right, sounds good. So, that would conclude agenda number 9. And we might have something.
To public comment?
Oh,
Oh, yeah.
yeah. Okay, any further discussion or discussion? Any public comment here regarding the funds review and meeting? All right, David, can we please open it up to public comment via WebEx?
We are open for public comment on agenda item 9. If you'd like to make a comment, please raise a hand by tapping that hand button at the bottom of the screen. Or, yeah, dial-in users dial *3 to raise your hand, and we will call on people in the order we have requests. We're going to take just a few seconds now to see if we have a request for public comment. Seeing no request, do you wish to continue?
I'm sure she does, but hold on, David.
Sorry.
Do you wish to?
Yes, please, yeah, we can. We're good. Okay.
Did we open it up for public comment online?
Yes. Okay.
What is the next matter?
No, we don't. We learned it.
Yes, because sorry, I accidentally closed my agenda. So there was a petition hearing set for today. However, there was a notice concern, and so a motion to continue was set, and so therefore this matter does not need to be heard today. It'll be set for a future hearing or a future board meeting.
Okay, with that said, we will have to break for lunch. It's a little bit earlier than
we can continue with the calendar or with the agenda. We'll just move other items if you'd like.
Yeah, you can.
Yeah, it's noticed on the agenda that we can hear matters out of order.
Okay, so what would we prefer to move with the date? Okay. We could do 14. All right, so agenda number 14, discussion and possible action on requiring professional development units pertaining to the board's laws and regulations and possible implementation. Thanks. Yeah. Can we see, David, if we have any representatives from OTAC that are participating in the via WebEx?
If we have any members from OTEC, please raise your hand. We have at least one, Candace. Would you like to unmute their microphone?
Yes, please.
All right, Candace, we're sending you a request to unmute their mic.
Hello.
Hi, Candace. Do you have agenda in front of you? Agenda item 14?
Let me pull that up. I do not have it in front of me. I have the exact screen though. 1 second.
Sure. Yeah.
Working.
Well, we would like to find out from you whether or not OTAC would like to comment on this agenda item, because if you can comment, or if there's anybody else who was planning on attending tomorrow and having comments on this, then we would keep it, this agenda item for tomorrow. But if not, we will proceed with it today.
Our president, Samia Rafidi, is able to attend tomorrow. My computer's just being a tiny bit slow. It's almost loaded up this document. And I know that she would love to comment as well if you'd like to proceed with waiting for her tomorrow.
All right.
Right now, 14. Oh, it is a very long document. Once, apologies. I think it may be best to have Samia comment on it, as I would be remiss to speak for. I'm the treasurer, and I'd be remiss to speak for her, just in case. You know, I just don't want to get it wrong.
Okay, we'll hold this agenda item. We'll hold it until tomorrow. Thank you, Candace.
Thank you so much.
Thank you. Yeah. All right, so we will move on to 18. Okay, so we'll do it, Jen.
We need more time for the report as well, 16. Okay.
Are we good? Okay, so we're gonna proceed with agenda item 18, review and vote on approval of the board's 2025-2030 strategic plan. So just to summarize a little bit, what strategic plan is the board sets it for about 4 years in advance. Some boards do it 6 years in advance, some do it 3 years in advance. We chose to go with 4, just to kind of keep it there in the middle. And we just basically come up with the plan, what's important for the board and how to proceed. And throughout the 4 years, we go back to it and we'll make sure that we're addressing all the information that we wanted to address or issues or whatnot, or improvement in different areas for the board. So I can give you a few minutes if you'd like to just go through it. It's at the very end of the packet. And it has a little bit of the overview, and it has obviously about the board, and then the mission that we have, and then it's basically goal sections that are licensing and like breaking down to licensing, enforcement, outreach and communication, laws and regulations, and organization and administration effectiveness. Once again, this it was a survey that went out to, I believe, thousands of people. We had about 70 official responses. So this concludes the boards. So they interviewed every single board member. They interviewed every single staff member. And then the email went out, the survey went out to all the stakeholders. So they solid training group, they included, they just took all of this information, they narrow it down and basically put it in front of us. And now we have to go over it to make sure that we agree with everything we said during that session. And if we do, then we vote on it today. And if not, then we have to make changes. So with that said, board members, does anybody have any comments based on what we see in front of us before?
I just wanted to see the message from the president.
I'm working on it. I had a couple delays. But it's gonna be there. And the one that I didn't find my papers, but the goal for laws and regulations, I felt like we had a couple of points there.
That was something that I asked Solid about when they handed us this draft strategic plan. And I noticed the same thing. And they had mentioned that their upper management had advised moving some of the goal areas to different, or some of the goals to different goal areas. So they're all there, everything that we discussed, they're present. But for example, I think that one of the things that we had talked about, or that the board had mentioned at the strategic planning session, got moved to goal 5, organization and administration effectiveness. I don't have off the top of my head exactly which one that was, but they're all there. They just moved a couple of them to adjacent goal areas.
So do you all feel that this reflects what we have agreed on?
Yeah, I reviewed it and it looked fine to me.
Me too. Hector?
I'm good with it.
All right, thank you. All right, so, we need a motion. Oh, public comment still. Do anybody have a public comment in the audience here? Yeah. Please feel free to come to the microphone.
So thank you for letting me speak. I was reading the strategy plan, and in goal number 1, the licensing, it says explore creating a law and ethics exam or mandatory continuing education. I mean, in the curriculum, we do cover that in the OT program. So I just want to get more ideas on what that exam will entail so that, students are prepared. Or I know this is a part of the continued education, but what is different from what they will be learning in the school? So if there's something I can invest.
So I'm sure since you run this program and you can speak to it, your school does a great job about doing that. And every school may do a great job, but people aren't coming out either remembering that information or having a working knowledge of that information. So this comes up when we have enforcement cases and people have done things and they say, well, we never learned that, or we, that was never told to us. Even if we have a hunch that perhaps it was, it's good to have a reminder to study and to have on the record that they did actually get this information at another level. So it would just be basic information about what is part of law, how many OT assistants are you allowed to supervise, just basic things like that. And again, we're just going to explore the idea. We're not sure which direction we're going to go. It may end up being a law and ethics exam. It may be some sort of continuing education that'll be part of, renewing your license. Like now we're going to have mandatory continuing education in what is it?
Ethics.
Ethics, right? Oh, okay. And maybe adding law to that, part of the law, like understanding laws. We're not sure which direction we're going to go. We just, it's a little disheartening to hear, like, I didn't know that.
Okay.
I never learned
So
that.
anytime when we will renew our license, this will be kind of mandatory to take that.
I don't think it would be every time. I think it would be every so often. But again, when we have to look at it,
Okay.
the board is just, we're going to explore it. That's what this is about.
Agenda item 14 is part of that. We're not talking about agenda item 14 yet. It's scheduled for tomorrow, but that reflects, it's actually helps fulfill that goal, strategic plan. Goal is to look.
Clarification.
I understand. I mean, yeah, when people see this, I understand. It's a test. They're like, oh, what? It's the very beginning stages of, how can we make this better to make sure that everyone understands the law? The law is constantly changing.
Exactly.
And so what are we going to do to make this better so that the consumers are more safe, practitioners understand, and they're taking a vested interest in what they need to know.
Thank you for clarifying.
Yeah, eliminating gray area. Yeah. Thank you. Anybody else? David, could we please open it up? Yeah,
We are open for public comment on agenda item 18. If you'd like to make a comment, please raise a hand by tapping that hand button at the bottom of the screen. Dial-in users dial *3 to raise your hand, and we will call on people in the order we have requests. And our first request is coming from Candace. Hold on just a moment. We're sending you a request to unmute your microphone.
Awesome. Thank you so much, Candace Chapman here. I appreciate the efforts that you're going through to ensure that people are aware of the law. I'm a professor at USC and an academic filter coordinator, and we often hear that through self-report, oh, I didn't learn that in school. It's like, I know we taught this to you, so I appreciate additional measures for the public to be able to, all right, well, it's now just not the onus of the education you went through, but also like access to additional resources, maybe provided online on the CBOT website, so that they are learning these laws, or that it's more the responsibility of the licensee. Because I can imagine it's as shocking as it is to you. We hear that all of the time from our fieldwork educators who will ask our students a question, and they're adults, and they're adults, and they're preparing, and they just exited the theoretical part, the learning part of their program, and their response also is, "Oh, I didn't learn that." People are very quick to be like, "Oh no, it's not my responsibility." So I do appreciate the extra measure to make sure it is their responsibility to learn these things. Um, and I think that any assistance that can be provided through CBOT would be helpful.
Thank you for that comment. I'm an adjunct professor and I take clinical students in clinic, and I hear both sides of it too. So thank you.
Thank you, Candace. That was great. That is good support too, because especially from colleges.
I think it's just human nature. It's human nature.
Yes.
Our next comment comes from Ada Boone Horrell. Hold on just a moment. We're sending you a request to unmute your microphone.
Thank you. As an educator and a program director, I understand about students saying I didn't learn that, and we know that they did. But another thought process that we go through when we decide something to be required is we know that students don't do optional. So generalizing that over to licensees, this may not be the first choice of their continuing education, and to have a requirement to keep it foremost in their mind would be support it. I hear from fieldwork educators, your student told me some information about the regs, and I didn't look it up, but I just wanted to, talk to you about why they said that or whatever. So maybe they're not saying I didn't learn that, but they're citing or interpreting incorrectly. So having that periodic renewal and refreshing, as a practitioner and an educator, I very much support that.
Yeah, that's a good point. Or maybe it's changed. Maybe it used to be one way and now it's changed. So yeah, good point.
Yeah. Thank you.
Thank you, Ada.
And those were all of our online requests.
Thank you, David.
I'll move to approve the strategic plan.
Second. All right, any further board discussions? No, any further public comments? David, could we please open it up? Oh, Hector, are you still there? We don't see you. We just see your name.
No, I'm still here.
All right, do you have any comments?
Not at this moment.
Member Cabrera, you are required to have your camera on.
Oh.
You can
Okay, so no public comment. Okay, David, could we please open it up via WebEx, public comment?
We are open for public comment via WebEx on the motion. If you'd like to make a comment, please raise a hand by tapping that hand button at the bottom of the screen. Dial-in users dial *3 to raise your hand, and we will call on people in the order we have requests. We're going to take just a few seconds now to see if we have a request for public comment. Seeing no requests, you wish to continue with the motion?
Yes, please. Thank you.
Hector Cabrera. On the motion.
Yes.
Lina Doe. Richard Bookwalter, yes. Christine Whitlisbach.
Yes.
Beata Morcos.
All righty, we're gonna Move on to agenda number 17, the legislative update. Sorry, we're trying to figure out what will sort best today and versus tomorrow. That's why it's not really in order, but it's still on the agenda.
So provided in the packet is the first part of item 17. Well, that's going to be the legislative calendar is first, but after that, we have a table of bills that were put together by staff that may have some impact on the occupational therapy profession or may be of interest to the board. We erred on the side of caution for preparing this list to present in front of the board members. Anything they might want to take a position on or have something to say about. So there may be some in here that they decide are not relevant or worth, for them to address. But this is what has been introduced to the legislature for this legislative session. And their summaries are in the table and the full bills are following the table. So if you guys, if you want to talk about it or if you want to take a position or anything.
I'm sorry, I can't, what did you say?
2775, unless I'm missing something.
Richard, do you mind going through this since you are the legislative committee?
I'm sure. I mean, we didn't actually meet. We haven't had the legislative committee meet, but I did review these bills. Maybe we should, and the board can decide whether they want to refer them to the committee or just deal with them here. So the first one, the behavioral health centers, this is AB 277 in the packet. It is to require background checks for certain parties who, because there are certain laws, a person who provides behavioral health treatment for a behavioral health center, for example, licensed professions have to be fingerprinted or have to have background checks. But the behavioral health people, and correct me if I'm wrong, I think you might know more than I do about this, Christine, because you were on the BBS, Board of Behavioral Sciences, but I don't believe that they are licensed. So this is a bill that would require them to be background checked separate from.
That's her favorite matter.
Well, criminal history, the California Constitution requires the state to reimburse local agencies and districts for certain costs. Let's see. No, sorry, I'm looking.
I'm not sure who it's referring to, because everyone on BPS requires.
Right, but are behavioral health specialists licensed?
Oh, them, oh.
No, so this would subject them to background checks just like a licensed person. So this would extend the back. Is that am I reading this correctly? Yeah.
Other people who get behavioral health treatment, like
A person who provides behavioral health treatment,
not a licensed
they have to have a background check.
Yes, I'm thinking, I didn't look this up, but.
Yeah. That's so I figured like unlicensed people who provide behavioral health treatments need to have background checks to conform with all the other laws. So that sounds like that's how I looked at it. I put a W on it for watch, but I mean maybe we don't even have to watch it if you think it's not if it's not close enough to what we're doing.
I think you were thinking behavior analysts.
Probably because we had several bills come before us with different categories of behavioral health people, and then some of them pass and some of them but usually they don't pass. And I do get a little confused about the different types. It sounds, I mean, we could support it or we could watch it or we could.
Well, I think I think we should watch it. Here's why, because there are OTs working in behavioral health centers that invoke that. So I think we could watch it.
Mm-hmm. But OT practitioners are all get background checks.
Right, but they're going to be working side by side with these.
Oh, well, so side by side with these people. Oh, okay.
Yeah, we have background check too then?
Well, that's what this bill.
Yeah,
so that your coworker that you're referring to, you could be confident that they would be background checked if you're.
I mean, I'm guessing. Yeah, let's just watch this.
We can watch it, but yeah, I wouldn't want to support it.
We have to wait on
Right.
because we're not.
Yeah. Okay.
All right.
Watch it.
And we don't, do we need to take a vote for watching? We don't, no, we don't need to.
No, watch is the default. So the board would only need to vote if they wish to do something other than watch.
Either approve. Okay, thanks. The second one, Bill 346, is a in-home supportive services. There are a couple of in-home supportive services bills here. This affects occupational therapists because occupational therapists are among the licensed professions who are allowed to attest to what in-home supportive services is a program under Medi-Cal where a person who has Medi-Cal can get gets a little bit of money, certain hours, and the person can come into their house and provide them with personal care or ADLs or IADLs. So personal care or like shopping, cooking, cleaning. And that's people on Medi-Cal who are unable to do those activities themselves. And they do an analysis and they say, you get, 20 hours a month, you get 100 hours a month, you get whatever, based on your level of function and disability. And OTs are among, page 3, it shows the existing language where occupational therapists are allowed to, or one of the professions that are allowed to say, what a person is not able to do or able or not able to do, which affects how many hours they get for IHSS. And then this just adds a definition of a licensed healthcare professional to be the same as healthcare practitioner as defined in section 680 of the Business and Professions Code, which I had to look up because I don't know what does that mean? Well, that's the only change, as a licensed healthcare professional is the same as section 680 of the Business and Professions Code. When I looked up section 680 of the Business and Professions Code, which I did not print out for this meeting, unfortunately, it basically just said licensed people licensed under this act. Maybe we should look it up. Do you have it?
Except as otherwise provided in section, the healthcare practitioner shall disclose while working his or her name and practitioner's license status as granted by the state on a name tag in at least 18-point type. A healthcare practitioner in a practice or an office whose license is prominently displayed may opt not wear a name tag. The healthcare practitioner or licensed clinical social worker working in a psychiatric setting or in a setting that is not licensed by the state, the employing entity or agency shall have the discretion to make an exception from the name tag requirement from individual safety or therapeutic concerns. In the interest of public safety and consumer awareness, it shall be unlawful for any person to use the title nurse in reference to himself or herself in that capacity except for the individual who is a registered nurse or licensed vocational nurse or otherwise provided in section 2800. Nothing in this section shall prohibit a certified nursing assistant from using this facilities licensed by the State Department of Social Services and the State Department of Public Health, where the State Department of Health Care Services shall develop and implement policies to ensure that healthcare practitioners provide care in those facilities from compliance with subdivision A, the State Department of Social Services and the State Department of Public Health, the State Department of Health Care Services.
You're reading, so there's a really, the definitions part is much shorter than that. It's, but I had to search, I found, that's what you find first.
Oh, there it is.
C, part C. Yeah.
So C, the purpose of this article, healthcare practitioners being any person who engages in acts that are the subject of licensure or regulation under this division or under any initiative act referred to in this division.
So basically anybody who's licensed under California law. So it didn't have this, it's not a super substantive change.
change or slight expansion of the definition would be referred to by this.
I thought we should watch it just because what if they change it and add something, put something else in there that might affect us, so that we should probably watch it. I did not know that we were a IHSS approved group, because I think different procedures and policies are different. Are there any OTs here who have done IHSS attestations? I have not done it. Do you want to move on, or do we public comment on any of these, or you want to do President Marcos? Just keep going?
Let's keep going.
To 348? Okay. I think I did not get 348 in my packet. Did we have an extra 348? And then I printed something out that's about beverage containers, which I think is, I did the wrong, I think I got the wrong one. Thank you, I'm sorry. Oh, Krell, yes. This is the I did read this, but for some reason I printed out the wrong one. This is AB 348. This is AB 348 for some other year. Yeah. That printed out for me, I apologize. This has to do with the services available to people with severe mental health problems. And it talks about occupational therapy as a supportive service. But mostly that's the existing language, and they're really, the substance of the bill has to do with full service partnerships, which are programs that the state has been implementing for different populations to integrate the services so they're less disjointed and more together. I know they've done that for children. In my field, I've seen a lot of that, and the whole child model is kind of like that. It sounded to me like the whole child model for children, and now it's a similar kind of thing for mental health services, the full service partnership program. So it's more one-stop shopping approach to mental health services, and OTs are listed as one of the supportive services on page 5. Half about line number 22, OT, occupational therapy by an occupational therapist is on lines 29 and 30 on page 5. But it's not, that's the old language. It's not, there's no change. It's just the changes are all on page 4 from sections 4 to 26, and they talk about the nature of these partnerships, that it's not specifically.
I think it might be about it's the legislative summary or digest, whatever you want to call it, talks about this bill. Would specify that a county is not required to enroll an individual who meets the presumptive eligibility criteria if doing so will receive full service partnership funding. I think is the change. Some more in there.
Oh, I see. Oh, not presumptively eligible. Okay. So it puts a lid on its funding, potentially.
But there wouldn't be an obligation for the county to enroll an eligible person if the funding is at its limit.
So it reduces a mandate, a state mandate a little bit. Okay. I mean, I thought we should watch it. Does that make sense to people? Thank you. Number 4, AB 489 by Banta was introduced, and this has to do with deceptive terms or letters and artificial intelligence. It defines as a crime a person who is not licensed as a specified healthcare professional to use certain words, letters, and phrases or any other items that imply that they are authorized to practice in that profession. So if you had an AI bot tell you what to do under occupational therapy practice, that would probably be illegal under this law.
In my opinion, I would support it, but we need to watch it.
Yeah, I had questioned watch or support. I didn't know. And it would result in us, we would probably need to establish some regulations if this is passed. To how do we, which words or phrases would be occupational therapy related? You know, that would constitute a violation of this provision. Because we determine the scope of practice of occupational therapy. We're the arbiter of what's occupational therapy and what isn't. So if there's an AI bot putting themselves out there as providing occupational therapy information, we would probably need to establish regulations to determine what that is. So it's very important for us to keep track of this at the very least.
It is also possible that because it affects all healthcare professions, DCA may do some more generic for the healthcare. What is it? Health?
Like healing arts?
Healing arts, thank you. The healing arts, so more generic ones. But yeah, we would probably want to watch it to see if each healthcare provision was going to need to do their own regs.
Yeah, I figured it would be a bigger law than just CBOT coming up with our own regulations for that. That's it, it's statewide.
It says in the beginning, first line says existing law establishes various healing arts boards within the Department of Consumer Affairs that like to regulate various healing arts licenses. So that's kind of that, one way or another. So definitely watch it.
Support it?
I think we should support.
Hector, what do you think? We cannot hear you speaking.
I'm sorry.
Okay,
Repeat the
we can
question,
hear you now.
yeah.
What do you think about this bill? Should we support it or should we watch it?
We should watch it and go back on taking a stance on it.
Thank you. Lena, Houston.
I want to know what the existing laws are, because it says it's a law within consumer affairs. Already has some law, but we affects us regardless of we're under consumer affairs. I mean, I'm on fence about if we need to watch or support because it's gonna head the way that we need to support it. But we don't have a lot.
We can watch it until it gets more specific and you're talking about tech.
When's our next meeting? June? We could look at it in June and.
Sure.
I think as we watch it, staff is gonna monitor it, and if something comes up, then we need to take action on it.
So it would be June that the board would take an action on this.
We could, I mean, it'll probably change. 'Cause the law, you know, they change, they negotiate with different parties.
Right.
And see, I can also look up to see if there's any support for it now. I'll look at the legislative website and it tells you who supports it.
And this might be a good time to mention that we did receive a request from DCA to do like a financial impact analysis for this bill, so they're aware that it is going to affect
The boards, yeah.
You know what additional costs the board would need to regulate and enforce anything that comes out of this.
On that note, it may be prudent to wait to see what the financial impact would be before we take a support position.
Right. So,
or support with amendments or something to that effect.
So yeah, I would be comfortable saying watch, and then if something comes up,
We could.
take action beforehand.
I want to know the anyways.
The bill analysis is blank. The history of the bill was introduced. It was read the first time on February 10th. It's maybe heard in committee on March 13th. So there's a hearing coming up on March 13th next week. So then we'll probably know more. But they haven't got the usually before the hearings, they produce an analysis that tells you who's supporting it and who's against it, but that's not here yet, so maybe that'll probably come out next week. So probably we'll know more after that.
Just watch.
And then be sure to put it on the agenda though for June. I think we'd want to, well, we're watching it, so that would be great. I agree. That makes sense what we're saying. If
And then
GCA
just-
is asking for costs.
Yeah, and just so that the board is aware, Bagley Keene also allows for what's known as a special meeting, so a short notice meeting, if there's a major legislative impact that will happen before the board can meet again. Right?
Do we?
Should we go to the public?
It's always a good time for public comment.
Do we have any comments in our public audience? No? David, can we please open it up via WebEx?
We are open for public comment via WebEx on agenda item 17. If you'd like to make a comment, please raise a hand by tapping that hand button at the bottom of the screen. Dial-in users dial *3 to raise your hand, and we will call on people in the order we have requests. We're going to take just a few seconds now to see if we have a request for public comment. Seeing no request for public comment, do you wish to continue with the agenda?
Yes, thank you. Right.
All right, we're moving on to Assembly Bill 667 by Assemblymember Salash. This has to do with interpreters.
Alan,
Yes.
my current job deals with interpreters and translation. Should I leave the room and not discuss this because it would potentially positively impact me if this?
Recuse, yeah. She wants to recuse herself.
If yes, I mean, if you, so because interpreter can be doing a lot of things, is your sole position strictly in providing,
Provide interpreters and translators to states, which is involved. So yes,
Okay.
I would be potentially positively impacted.
so you can recuse but at this point, since you've announced, you don't need to completely run out of the room. Because all of this is public, so you would just not participate in the discussion nor vote.
Maintain a stone face throughout the discussion.
None of the members look at her just in case. There you go.
This bill would require interpretation under certain conditions, and talk about who can interpret. Level of language proficiency and other factors.
It looks like it's specifically for the application exam, as long as they meet all the other requirements for licensure, if they do need language assistance with the examination.
We don't have an examination.
That's right, we don't have an examination.
We do, except the MCT is ours. It's not our examination.
Right. It allows people to take the exam who do not speak English and or read English and use an interpreter to do so. So we don't have a dog in this fight. That's true.
If I may, we do have an examination, a licensure examination, don't we? Isn't one required
It's
for licensure?
not a state administered.
Correct. But that's a different question. But it is possible that when we contract with this entity.
We don't contract with them.
Okay, so it just exists and we accept.
Correct.
A national one that we have nothing in. Okay, there are ones that have, for example, a national examination in which the board must contract and they provide certain terms and they pay for that service and do all.
Right.
Okay.
Which is always a question on the Sunset Report too, by the way. They was asking about our examination. We have to say we don't have an exam.
Perfect.
I know we haven't had the discussion about jurisprudence or laws and ethics, but if that was something, would that be affected by this?
It looks at this time that it would be for the initial licenses, but that may be something to watch for to see if they require for all future examinations that may occur. Which that may go into our analysis as to whether we'd like an examination versus continuing education.
Shall we watch it in case that, because it might have an effect? See how, if it changes? Even though we don't have an exam? Yeah, if they did, if they didn't, we wouldn't necessarily need to, but if they do, yeah. Okay. Moving on to AB 742. This is similar to a bill that was that came in last year about prioritizing applicants who are descendants of slaves, especially applicants who are descended from a person enslaved within the United States. It didn't pass last year, but we did watch it. Should we do the same this year, since it would affect we would be required to provide expedited licensure if this goes through, as several other expedited licensure bills have passed and failed over the past few years.
Suggest we watch it since they have another meeting on March 21st.
Okay.
I'd say the same thing. Let's watch this.
Okay.
Yeah, let's. Did you say it didn't pass last time, or?
It did not.
Mm-hmm.
There are 3 or 4 bills with different populations for expedited licensure populations, and I think one passed and 2 or 3 did not pass. But anyway.
Okay. Well, let's go ahead and watch it and see.
Okay. Moving on to 951, AB 951, Assemblymember Ta. It mandates that health insurance provide coverage for behavioral health treatment for pervasive developmental disorder or autism. But on page 3, lines 6 through 9 is to me was the most substantial part of this, whereby a healthcare service plan shall not require an enrollee previously diagnosed with pervasive developmental disorder or autism to receive a rediagnosis to maintain coverage for behavioral health treatment. I thought we should watch that because it would affect reevaluations.
There's value in supporting it.
That's an open discussion. Supporting, well,
What are your thoughts on that?
my thoughts are, on the one hand, it's a burdensome to families to have to go through rediagnosis to qualify for insurance again and again and again, and that's a terrible thing. And I think that's what this is trying to reduce the hurdles for. On the other hand, in my experience, it is possible to find someone there are parents who strive to get a diagnosis, who shop for diagnoses, and you can almost always find one eventually if you pay enough money or shop hard enough. And it requires people to accept a diagnosis from anybody who's got a pulse and a medical license. And I have seen fraud as well in my practice, where I'll just say, wheelchair people, they have a van parked out of a senior center, and they pull people out and say, "You want a power wheelchair? We'll get a doctor to sign an order for one," and they didn't qualify. They didn't meet any of the medical need requirements, and then the doctor was fined and blah 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 later. So I have to say, I'm very cynical. So I see this, and I see both sides of the issue. And you're requiring that a person. Have you ever tried to discharge a client who you can't discharge because the parents are so assertive, or the client is so assertive, but you don't really see the benefit of therapy, and this would require the insurance companies to pay someone endlessly for something. Now, I think that's a tiny subset, and I think that I applaud what this is trying to do. And I've seen also Medi-Cal people unable to, their Medi-Cal gets discontinued when they have to re-up for Medi-Cal all the time because they don't, it's a population that is very challenged by doing all this paperwork, and people have to have computers and printers and phones, and then their Medi-Cal gets canceled because they have to re-up. That's ridiculous when their situation hasn't changed. So I see both sides of the issue. I think that's probably a bigger issue than the fraud issue, but
Sir Richard, where would you like to go with this?
I would watch it.
Watch it?
I'll make your recommendation.
Yeah, I'll go with it too. Let's watch this.
This might be a public comment question.
Do you have any public comments regarding this bill? No? Wait, David, can we please open it to public comments via WebEx?
We are open for public comment via WebEx. If you'd like to make a comment, please raise a hand by tapping that hand button at the bottom of the screen. Dial-in users dial *3 to raise your hand, and we will call on people in the order we have requests. And our first comment is coming from Candace. Hold on just a moment. We're sending you a request to unmute your microphone.
Awesome. Thank you so much. This is Candace from USC and OTAC. I really appreciate the way Richard is being able to speak to both sides of this issue, especially because, you know, yes, there's always the potential for fraud. Having been a pediatric OT, also the necessity of making sure our children with and families of children with autism can continue to get service is such an important issue, especially since it's currently so hard to get off the wait list to get services to address autism and behavioral health for individuals diagnosed with autism. And so I just wanted to definitely make a statement that I appreciate you being able to see both sides of it, and that it is probably a very small percentage of individuals with autism and their families who would be using their not having to get reevaluated or reclassified as autistic each year as a fraudulently. And so I thank you.
Thank you, Candace.
And that was our only request for public comment.
Thank you, David. We're watching.
Yeah, maybe they'll come up with better language that we could support by June.
Yeah, because they have another meeting on March 23rd.
Yeah. The AB 1009 is our next one, and this is a bill that is very similar to the bill, if not identical to the bill that passed last year that this board supported, sponsored by the Occupational Therapy Association of California and others for a teacher credentialing administrative credential services credential for occupational and physical therapists in the schools. We voted in support of it last year. I would think that we would do the same this year. I would support it. It's a long-standing issue for us occupational therapists serving in the schools. And we could perhaps reiterate, we could even just use borrow language from the letter of support that we wrote last year at the last legislative session.
Well, they did tweak it a little bit, but
yeah. Re-edit. That would probably require a motion.
Can we move to support?
I'll second.
Any further board discussion? Any public comment? David, can we please open it up?
We are open for public comment on the motion via WebEx. If you'd like to make a comment, please raise a hand by tapping that hand button at the bottom of the screen. Dial-in users dial *3 to raise your hand, and we will call on people in the order we have requests. Our first request is coming from Candace. Hold on just a moment. We're sending you a request to unmute your microphone.
Thank you. As a member and a board positioned for OTAC, we appreciate the support. And as a pediatric OT, I also appreciate the board support on this. So thank you. I just wanted to make sure that is on the record that I do appreciate your support for this, because it has been such a long time coming, and we do plan on attempting to all right, we're going to just keep bringing it back. And just so thank you.
Thank you, Candace. Thank you, OTEP.
And that was our only request for public comment.
Okay, vote, motion to support AB 1009. Hector Cabrera,
Yes.
Linda Doe, Richard Bookwalter, yes. Christine Whitleysbach,
Yes.
Beata Morcos.
Motion carried.
All right, we have sent SB 641. This has to do with emergencies.
Do we need to have the staff send the letter of support?
Oh,
I know, did we take the vote? Oh, yes, we did, yes. So then staff is now directed to draft up an order and submit it to the legislature. Sorry.
Just for the record. Sorry, Richard.
yeah, so this SB 641 is our next one, and it talks about exempting people in disaster areas. A license to use home or business mailing address is located in an area for which a federal, state, or local emergency or disaster area is declared, may be exempted from certain certain requirements. I thought this was interesting because people have, we have rules about people in, who you have to do an address change. You have to do, you have these requirements, and we often get in our violations are people didn't change their address, they didn't get their CEU, they didn't get their CEU audit sent back, and they didn't respond to anything, and then they end up maybe even they lose their license because they didn't respond to anything, and we could never reach them. And this exempts two things, it looked like to me, and correct me if I'm wrong, but it looked like continuing education and then, yeah, exam fee and also an address change. I didn't know, it looked like an address change too. Or no, what if they didn't, they're not subject to an address change, but there was no time limit on this. Like how long do they have after the disaster to provide their address or to reconnect? This didn't seem to have that. I couldn't find that here, and I was just wondering if anybody else could.
So
Is it just it's one cycle of renewal, and then the following cycle they have to do it? It doesn't.
So I saw under, looks like section 7, until 90 days following the end of the emergency. But I do know that DCA wide, we're kind of looking at this, and one of the things, I don't know that we sponsored this bill, or we had anything to do with this bill, but one of the things that happens during a
There it is.
declaration of an emergency is that DCA wide, we start looking for whatever might be impacted and whatever laws we need to ask the governor to waive or otherwise create an emergency order for us. So theoretically, this is supposed to aid in that. I don't know if DCA has had a say on anything about this, since it would be DCA wide, but theoretically it would be for a certain period of time after the emergency ceases, in order to allow people to get back to what they're doing. Because in addition to the fire we had recently, this is California, earthquakes, and then of course the pandemic. So this would aid in some of that process and allow the law to set forth things that can go into action immediately rather than an executive order. But I do not know if DCA has made any particular comment, or if they're waiting for the boards to have a say, or if the board would like the interim executive officer to maybe discuss with the powers that be of DCA to see if they would like support or what they would like. But theoretically, that is the intent of this bill.
I think before we do anything, we better find out if DCA is in support of this, because there may be some language in here that are like, oh, yeah, one in theory, but this language is not gonna work, blanket or whatever. We better investigate further.
That's adjustment, just watch it.
Yeah, I think that makes sense.
But maybe we could direct,
Maybe staff could ask.
yeah, just reach out to DCA and just find out, like, hey, what do you think of this bill? Like the language?
Absolutely.
Yeah.
Yeah, it's on our radar. What do we do? Okay.
So we're going to watch that one, SB 641. Okay. Now we're looking at SB 813. Now this was very interesting that because we've had this on our this board has had on our future agenda for years. You know, how long does private practice keep records? And here's a bill that talks about keeping records. And it says existing law requires client records to be maintained for a period of not less than 7 years, and this bill would increase the time frame to 10 years following discharge of the client.
Most records now in digital form, or are they still paper?
Yeah, both.
That's what makes it complicated.
I'm interested in where this is coming from. And this has to do with records of unemancipated minors shall be maintained at least 1 year after the minor has reached the age of 18 years. So it has to do with, we have some pediatric therapists, so it'd be interesting to hear from them.
Do we have any comments in person? No? All right, David, can we please open it up via WebEx?
We are once again open for public comment via WebEx. If you'd like to make a comment, please raise a hand by tapping that hand button at the bottom of the screen. Dial-in users dial *3 to raise your hand, and we will call on people in the order we have requests. We're going to take just a few seconds now to see if we have a request for public comment. Seeing no request for public comment, do you wish to continue with the agenda?
Yes. Please.
We didn't introduce ourselves. That must have.
Can we ask, can we
It could come from a parent.
to contact the author's office and ask them where it came from?
Yeah.
We're gonna just ask Sammy tomorrow.
Yeah, we could save it for tomorrow. But it might be, I mean, I could see a parent going to the senator and saying, my child's records were destroyed and they were 16 years old, and I wanted it, the child has a, or the child, him or herself, themselves would go and say, I was 21 and I couldn't get my records. And I wanted my records of my occupational therapy because I have concerns about it.
Yeah.
Specific to occupational therapy. So there may be a triggering incident.
I mean, so we just can find out where this came from.
Or maybe the parents consented to it.
They want, they can tell us.
Right.
And I'd like to know if OTAC's got any feedback on this thing discussed. Yeah, can we talk about it?
Yes.
tomorrow?
Yeah.
Let's do it. So the SB 813, we're gonna move it to tomorrow when we have representatives from OPAC participating. Well, thank you so much, Richard, for the update of the legislator. All right, so as of now,
Final public comment.
public is still, which is good.
Always at the end of any agenda.
Okay, okay. So, do we have any public comments? In person? No. David, could we please open it up via WebEx?
We are once again open for public comment via WebEx. If you'd like to make a comment, please raise a hand by tapping that hand button at the bottom of the screen. Dial-in users dial *3 to raise your hand, and we will call on people in the order we have requests. We're going to take just a few seconds now to see if we have a request for public comment. Seeing no request, you wish to continue?
Thank you, David. So for now, we're gonna close for lunch. And then when we reopen, we're just gonna go to closed session because we have a lot of matters there and that would be private. So at this point, we will not, I mean, we'll just open an open session for a few seconds and then we adjourn the meeting. But we'll see you tomorrow at 9:30 in the morning, and please make sure that everybody's gonna go to the presentation at 1:30 p.m.
And just to clarify, the only matter that will occur in public session will be to establish quorum.